Hello, welcome to this month's edition of the Medical Minute. I'm your host, Chastity Darfus, and today I'm joined by rheumatologist Dr. Christopher Redmond. Good morning, Dr. Redmond. How are you?
Thanks. Happy to be here.
Good. So we're going to talk a little bit about rheumatology, which is, joint pain, autoimmune issues, and what you actually do. Can you tell us a little bit about what a rheumatologist does?
Sure, yeah. So rheumatologists deal with conditions that affect connective tissue. So that's joints, bone, skin, blood vessels. Primarily it's autoimmune diseases, so conditions where your body's making inflammation in those tissues. The most common conditions treated would be rheumatoid arthritis, lupus, psoriatic arthritis, and things of that nature. We also deal with more rare conditions affecting those tissues, and we also deal with things such as osteoporosis, which is weakening of the bones, and osteoarthritis, which is more just degenerative arthritis of which is kind of more commonly seen.
How does that inflammation show up in the body?
It can be a lot of different ways. So in terms of inflammatory arthritis, the most common presenting symptoms are joint stiffness. So it would be significant stiffness in the morning or with prolonged periods of inactivity. So waking up in the morning, having issues moving your joints for approximately 30 to 60 minutes, or if you've been seated for a long period of time, having the same amount of stiffness afterwards. Additionally, there can be significant swelling, particularly in the joints of the hands, the knees, elbows, things of that nature. And then sometimes there will be some pain as well.
Okay. So how would a person know if they're experiencing a rheumatology disorder versus orthopedic? Because some of they sound very similar.
Yeah, that's a great question. So I think stiffness is probably one of the big things, and how your body responds to activity. So if someone has an autoimmune or inflammatory arthritis, typically as the day progresses, your symptoms get better because you're active, you're moving the joints, you're pushing that inflammatory fluid out of the joints, and it actually starts to feel better and you gain range of motion. For kind of a more wear and tear, osteoarthritis, degenerative arthritis, all three of those names kind of mean the same thing, which is our conditions where the cartilage or cushioning between your bones wears away, causing bone spurs and pain, which would be the more orthopedic issues. Those typically get worse with activity because as you're using the joint, the bones rub more, causing more pain and more stiffness. So thinking about, do my joints get better as I go throughout the morning, or do my joints get worse as I use them throughout the morning, is a good way to differentiate between an autoimmune or rheumatology joint issue versus kind of an orthopedic issue.
Okay. And speaking of rheumatoid arthritis, you talked about the differences between that and osteoarthritis. What are some of the early warning signs of autoimmune disorders such as rheumatoid arthritis?
Yeah, you can have rashes are big, so you can have kind of non-specific kind of rashes, especially on kind of sun-exposed areas. That can be more for lupus, but you can have sometimes see that with rheumatoid arthritis. Significant joint swelling, and then you can also have some significant increase in fatigue. Sometimes you can have some weight loss and things like that can also be accompanying, but again, the joint stiffness kind of being the predominant feature.
Okay. And the next question actually comes from one of our Facebook followers who wanted to get some information on Ehlers-Danlos syndrome, if I said that correctly. Yeah. What exactly is it? How is it diagnosed? And what are some of the warning signs people should watch for?
Yeah, so that's a very good question from one of the Facebook followers. So Ehlers-Danlos syndrome, or Ehlers-Danlos syndrome, is kind of pronounced both ways, is a condition where that connective tissue that's inflamed in rheumatoid arthritis is not inflamed, but actually just abnormal or loose. And so the predominant feature of Ehlers-Danlos syndrome is hypermobile joints, meaning joints that can bend more than the natural range of motion expected for a joint. The predominant joints we look at are the joints in the hand, so if you can bend your joints in kind of funny ways. A lot of people say, I've just been double jointed my whole life, especially, or if you're extremely flexible, things of that nature. When you're a kid, there's nothing wrong with that. You're just the kid in the playground that can do the funny thing with your hand. But as you get older, that chronic recurrent overbending or hyperextension of the joint can lead to more early onset osteoarthritis, so that degenerative arthritis. It can also lead to just kind of more severe pain. It can be difficult to diagnose, but if you can ask your primary care doctor or you can come see a rheumatologist, and we'd be happy to kind of just do an evaluation in the clinic. There are several different types of Ehlers-Danlos syndrome. By far the most common is the hypermobile type, which is the predominant feature, as the name says. It's just hypermobility. And that is a clinical diagnosis, so there's no blood tests, there's genetic testing for other types of Ehlers-Danlos syndrome, but not this type. And so really it's just a physical exam by typically either a primary care doctor, rheumatologist, or sometimes a geneticist to confirm the diagnosis.
And that's going to lead us right into our next question. I know this is pretty broad, but how do you approach the diagnosis of autoimmune disorders? Is there certain testings that you do, imaging?
Yeah, and so this is the interesting and sometimes also challenging thing about rheumatology is it's very individualized. So it requires a pretty extensive visit. So usually our first visits are anywhere from 40 minutes to an hour. And the history and the physical exam are probably the most important parts. But there are some blood tests that we can do to look for markers in the blood for different types of autoimmune diseases. They can help us differentiate between lupus, rheumatoid arthritis, psoriatic arthritis, and things of that nature. Although a certain proportion of patients with those conditions will have completely normal blood work. And so that is to be expected. In those instances, sometimes we'll rely more on imaging to show signs of inflammatory arthritis. And also we'll usually get imaging in most patients with inflammatory arthritis or autoimmune arthritis to look for signs of damage to the bone that would be more suggestive of an autoimmune arthritis rather than just wear and tear arthritis. So usually combination of, again, the key part being physical exam and history, but also labs and imaging are usually a portion of the evaluation.
To me, it sounds hard to diagnose. Do you feel like a detective at times?
Yeah, a little Sherlock Holmesy, which is kind of fun sometimes.
Right.
Yeah.
Are there any lifestyle changes or habits that can help manage autoimmune disorders such as rheumatoid arthritis? Yeah,
that's a great question. And there's been some really interesting studies recently showing that decreased intake of ultra-processed foods, so that's any foods with preservatives, dyes, things like that, so the things you see in the center of the supermarket rather than the outside, can increase your risk of autoimmune disease. So eliminating those from your diet has been shown to be beneficial. So, and then also there's some evidence for things like some supplements such as, fish oils or CoQ10 enzymes that can help as well. But really the most evidence is for what we call a Mediterranean diet. So good oils, high in vegetables, lean meats, and then again, eliminating processed foods are probably the best things to reduce your risk of autoimmune arthritis. And also, if you do have autoimmune arthritis, reducing the severity of the arthritis.
So the Mediterranean diet is very popular because we had Dr. Murphy on, one of our cardiologists, and she's a big proponent of the Mediterranean diet also.
Definitely agree, yeah.
What role does exercise play, if any, in managing autoimmune disorders?
It's huge. So when you have any type of injury to a joint, or instability or abnormality in a joint, so whether it's wear and tear arthritis, osteoarthritis, or inflammatory arthritis, increasing the muscle strength of the bone, of the muscles around the joint, is one of the best things to help protect and preserve that joint and preserve your kind of function and mobility. So I'd say the overwhelming majority of patients that I see for inflammatory arthritis at some point get a physical therapy evaluation.
Okay.
So yeah.
So resistance and strength training is something you would recommend?
Yes, and I'd say a lot of resistance and strength training to, support the joints. And then, the number one of the biggest risk factors for, death in these patients is cardiovascular disease, just like just the general population, but even more so in people with autoimmune arthritis.
Okay.
So some aerobic exercise as well, in addition to the diet changes that we just discussed, are really important as well.
Is there a correlation between autoimmune disorder and heart disease? Yes.
So in the majority of autoimmune diseases, the number one cause of death is still heart disease, just like the general population, but it's just that much higher.
Okay.
So there is a component of heart disease that is actually inflammatory, and so if you have an autoimmune disease with systemic inflammation throughout your body, you're at a higher risk for that as well. So
stress in it is inevitable, but does it also play a role in autoimmune disorders?
Yes, I think that one of the biggest things is it's when you get diagnosed with a chronic condition, because for the majority of the types of autoimmune arthritis, there is no cure. They're very manageable with medications, but there is no cure. So being given a chronic diagnosis like that can be stressful, and it does add a lot of stress to your life. You have to take medications that can cause side effects, but I think mitigating or managing stress as best you can has been shown to improve outcomes as well. So sometimes if people have anxiety or stress related to their diagnosis, I recommend they see a counselor or therapist just to kind of work through that anxiety. And more often than not, it does help the treatment of their arthritis, as well as just improve their overall mental health.
So healthy diet, Mediterranean diet, resistance training, working with physical therapy. What are some of the other current treatment options available for autoimmune disorders?
Yeah, so the majority of the treatments focus on suppressing your body's ability to make inflammation. So, and so some of those are oral medications. A lot of them are injectables. So in medications, just you would inject under the skin. The patient would inject under their skin once. It can range once every week to once every 4 weeks, depending on the medication. And sometimes we have to do infusions of medications as well. But those are usually the types of medications we prescribe. Since they do suppress your body's ability to make inflammation, they do reduce your ability to fight infection as well. So you are at a slightly higher risk for infections, but usually just with proper vaccinations, avoiding kind of extreme, sick exposure. So, avoiding, maybe not being as in close contact with sick relatives or family members until they're feeling better. And that usually, and kind of general common sense stuff like hand washing, things like that, you can usually kind of live a normal life, and you don't have to kind of live in a bubble or anything like that. Yeah.
Okay, so what is one common myth or misconception about rheumatological conditions that you'd like to clear up?
Well, I respect and appreciate how when people say they can feel the inflammation in their body, and I think a lot of times when you see commercials talking about inflammation, it'll show kind of burning, stabbing pain throughout your body. But the things we talked about, how you would actually experience inflammation, is kind of different than what most people have been told their entire lives through commercials and advertising and things like that. Like I said, inflammation arthritis is usually, the pain is there, but usually it's a lot more stiffness. Most people, when they come in with inflammatory arthritis and they talk about their pain, they really just go like this because they just can't move their hands. If you have burning, stabbing pain radiating down your arms or legs, a lot of people feel that's inflammation, and it can be, but the majority of the time it's more degenerative arthritis causing nerve damage or nerve impinging on nerves or pinching nerves, causing that type of pain. It's a tough distinction to find, and usually it has to be done by a provider. But I think that is, kind of differentiating or figuring out which one of those you have is important because the treatment is very different.
Right.
Yeah.
How can patients best advocate for themselves when they are managing an autoimmune disorder or a chronic condition?
Yeah. I always tell patients, I love when you message me or, don't feel like you're bothering me at all. The more information, the better. Like I said, the most important way to evaluate arthritis is the history and the physical exam. So being present, and then also kind of any update, any change in your symptoms, let your providers know. Because sometimes, yes, there are labs we can use, but sometimes the labs don't become positive until after the symptoms start. So you may be experiencing symptoms before the labs show the arthritis that you've been experiencing. And just kind of keeping in touch with kind of what you're experiencing, how you're experiencing it, because that is by far the most important part of the evaluation for autoimmune arthritis is the history. Okay. Yeah.
Are there any online resources that you recommend for people to go out and research or have?
Yeah, the American College of Rheumatology has a wonderful, and that's kind of acrrheumatology.org. It's a wonderful resource that has a lot of information for patients. And then, for the fibromyalgia, there's a fibromyalgia group, it's just fibromyalgia.org. And then Dysautonomia International is a great resource for the hypermobility and people who have abnormalities with loose connective tissue. All those three resources are kind of usually where I tell patients to start their kind of journey in learning more about these types of conditions. But you can always ask your providers too, and they'd usually be happy to kind of guide you in the right direction.
Great. Well, thank you so much for being here today, Dr. Redmond. That concludes our Medical Minute. Thank you for joining us, and we will see you next time.